the EQ-5D Descriptive System. The EQ-5D instrument is a widely used versatile tool that's been developed to describe and value people's health-related quality of life. It can be used in population health surveys and to measure the impact of different health conditions and healthcare interventions. It comprises a short questionnaire called the Descriptive System and a visual analog scale, the EQ-VAS, which is described in a separate animation. The Descriptive System consists of 5 questions covering basic dimensions of health-related quality of life: mobility, self-care, usual activities, pain and discomfort, and anxiety and depression. In the EQ-5D-5L version, each question provides people completing the questionnaire with a choice of 5 answers corresponding to 5 levels of severity, which, when reported together, represent a health state. So, for example, Bob suffers from depression, and on the day that he completed the questionnaire, he reported no problems walking about, having moderate problems with self-care and also with usual activities, no pain or discomfort, and being extremely anxious or depressed. Bob's responses were then coded, with no problems given a 1 and the most severe problems given a 5. This means that Bob's health state, on the day he completed the EQ-5D, can be represented by the numbers 1, 3, 3, 1, 5. There are a total of 3,125 possible combinations to the 5 questions in the EQ-5D-5L. Each combination of answers represents a different health state. One thing it's important to remember is that the numbers in someone's EQ-5D health state should not simply be added together to produce a single summary health score. This is because such a score would not provide a full picture of their health in the 5 dimensions. The scoring of EQ-5D is explained in another animation. Here's another example of somebody completing the EQ-5D-5L descriptive system. Nadia suffers from osteoarthritis, and on the day that she completed the questionnaire, she reported being unable to walk about, having moderate problems with self-care and usual activities, severe pain or discomfort, and being slightly anxious or depressed. This means that Nadia's health state was 53342. Nadia's profile provides a useful snapshot of her health at a point in time across the 5 health dimensions. If Nadia completes the questionnaire again later, then changes in her health-related quality of life can be captured. For example, before a hip replacement, Nadia might report being unable to walk around, but might report only slight problems afterwards. We would likely see improvements on other EQ-5D dimensions as well. Nadia could be involved in a clinical trial. In this case, her results would be just one set of results within the total study population. Imagine Nadia is part of a clinical trial of a new hip replacement device and is included in the treatment arm for the new device. The EQ-5D-5L descriptive system results for her group could then be compared with those for patients receiving the standard hip replacement device. If everyone completes EQ-5D before and after their hip replacement, we can see how the new treatment affects the different dimensions of their health, and we can compare results across the 2 devices. For example, the percentage of patients reporting no problems with mobility went from 15% before the hip operation with the standard device to 45% after the operation, while with the new device, the proportion with no problems with mobility went from 17% before the hip replacement to 65% afterwards, indicating the new device is more effective. This is just one way in which descriptive system data can be reported. The EQ-5D descriptive system can also be used in other ways, for example to monitor patient outcomes in clinics and hospitals or to assess population health. To find out more about analysing descriptive system data, a methods guide is available to download free of charge. For further information about the EQ-5D, please visit our website. EQ-5D, helping the world make better health decisions.